Good morning. Thank you so much for spending your Sunday morning to hear a little sharing from me regards to taking care of diabetes. I think all of you must be very frustrated over the last few months with all the restrictions or the lockdown measures, which are essential for our nation to take care of COVID. But I think the COVID virus is not the only health threat that we need to contend with. I think there are many other concerns from cancer to heart disease and other day-to-day ailments that threatens us. And one of them that I want to highlight to your attention this morning is on diabetes and why it is still a very important subject to consider even during this circuit breaker. Um, Earlier, they have already shown my brief biography. Essentially, as a consultant endocrinologist, I do enjoy helping my patients with various hormonal disorders. Um, Most common would be diabetes. Also very prevalent would be that of thyroid disorder, osteoporosis, calcium disorder, and other general hormonal issues. I do enjoy teaching people and helping them understand the issues that's bothering them in their body. Okay, so to start off this presentation, I'm going to first give us some idea of why is it so important? Why should we care? I have people who tell me, well, diabetes, blood sugar a little bit high, what's the big deal? Just a little bit high. Maybe in an older person, 80 years old, if the blood sugar is a bit high, is it really something so serious or can we just leave it alone? So I think we need to think a little bit more about why should we care about this issue. And then we talk a bit about how to recognize diabetes. Maybe think a little bit about what are the ways that we can prevent this condition. And I will just share a little bit of my own personal experience and my patients' experiences. Okay, so just show you something very graphic right now. Okay, and it's meant to uh, shock you. But it is true that in Singapore and worldwide, we have increasing number of patients with kidney failure requiring dialysis, with diabetes foot requiring amputations and affecting sight, among other things. In fact, if you look in terms of leading cause of blindness, diabetes. Leading cause of kidney failure, diabetes. Diabetes patients also tend to have problems with the nerves, numbness, and increased incidence of amputations. Not just this, it also affects the heart, it affects the brain and cerebral circulation with higher risk of stroke. So diabetes is not, if not controlled, can rob you of your years, especially if you have both diabetes and heart attack. But the good news is, if you were to take care of it early, take care of it well, can live well and live a long life. Okay, so now let's talk a little bit about, now that we know how serious diabetes is, let's talk about how do we recognize it. I think in the very old days, people already sort of understood what diabetes in its raw form, in its extreme form would look like. Flies and ants were attracted to the urine. I think some of you may have heard of stories of people telling you, say, when when I see ants attracted to my urine, I got scared. I quickly go and see a doctor. Now that is the classic description of diabetes. But not everyone has this classic description. In fact, some of the other symptoms would include they go to the toilet more often to pass urine, feeling very thirsty, feeling more hungry than usual, even though you are actually eating, more tired than usual, having blur vision, cuts, bruises, harder to heal, slower to heal, And one of the more serious feature is sudden weight loss. And that is not because you decided to have caloric restrictions and exercise vigorously. Sudden involuntary weight loss. These are some of the features that possibly could point you towards a diagnosis of diabetes. But let me highlight right at the bottom, no symptoms. That is actually the most common. Most patients with diabetes do not have any symptoms at all at the beginning. So how do you diagnose that? It's actually through a simple blood test that can be done with your GP, with your primary care doctor, with your specialist. Okay, so I'm going to spend a bit of time on this particular slide. I know you look at it and goes, wow, there's so many numbers. Okay, let me just help you orientate a little bit. First and foremost, in a chart, there are two columns here. One on the top, it says millimoles per liters, and the other says milligrams per deciliters. These are the two standard ways that we measure blood glucose. It's a bit like currency conversion. 1 millimoles per liter equals to 18 milligrams per deciliter. So when you see your doctor and they measure your blood sugar level, you need to know which unit they are using. For purpose of this presentation, I'll be using millimoles per liters. But if you want the milligrams per deciliter, all you need to do is multiply by 18. Okay, so before we eat, when we are fasted, a normal person blood sugar level would be below 6.1 millimoles per liter. If the blood sugar level before eating is 7 and above, that could signify diabetes. If it is 2 hours after eating, if it's below 7.8, that's normal response. If it's above 11.1, that may signify diabetes. And we also have another blood marker in percentage, HbA1c percentage, that gives us a 3-month average of what your blood sugar level is like. And if it's below 6%, that's probably quite normal. If it's above 7 and above, that may signify diabetes. So I think these are some of the numbers that I want to impress upon you. That's how doctors use the numbers to help make a diagnosis of diabetes or not diabetes, or perhaps an in-between condition called prediabetes, which I will not go too much into this presentation. Okay, there are many different types of diabetes, okay, but the most common is this thing called type 2 diabetes, all right, and that is what most patients with diabetes have. That it, in a sense, does not really matter which type of diabetes that you have. If I were to summarize it into one slide, it just means that your pancreas, so the pancreas is a very important organ that produces this insulin hormone. Insulin hormone is the hormone that helps us to regulate our blood sugar level, helps the muscle to use the blood sugar level. So if you have diabetes, it tells me that your pancreas is not working optimally. Or in some serious cases, the pancreas has totally stopped working. Okay, so let me just show you again. So sorry if the slides are a little bit too technical, but I'm trying to help you gain a deeper understanding about this diabetes condition, and more importantly, what is normal. So this is in a normal person. In a normal person, all right, let's say at 10 p.m., 11 p.m., going to sleep, not going to chom chom to have supper, going to sleep, the pancreas is producing small amount of insulin in the background, all the way midnight, all the way in the morning, 4 a.m., 6 a.m., 8 a.m., assuming at this time the person wakes up and have his breakfast, and the breakfast is a standard breakfast with carbohydrates. The pancreas will produce a huge amount of insulin. You can see the insulin shoots up. This is to help the person handle the carbohydrates and the sugar that is eaten, to keep the blood sugar level stable as healthy can be. You can see that similar spikes in insulin happens at lunchtime and at dinner time. And it's variable. it also depends on how much carbohydrates, how much sugar the person eats. So the more carbohydrates, the more sugar the person eats, the more insulin the pancreas has to secrete. If the person has diabetes, the pancreas is not able to produce enough insulin for that meal, and the blood sugar level will be high. Okay, so I think this is just to give you a very deeper understanding about this diabetes. Okay, it's not just a matter of the blood sugar level being high, but the mechanics of it is that the pancreas is not able to produce the important hormone insulin. Okay, briefly, these are technical slides. These are the same slides that I use to teach my students and doctors. Back in the old days, in the 1980s and the 1990s, we do not have many options to treat diabetes. We use some standard insulin injection, human insulin. We use certain basic pills, and we use this medicine called metformin. And we also tell the overweight patients to try to lose weight, because by doing so, it does help with their diabetes. But basically, our treatment options are very basic. I'm so glad that in the 21st century, we have many breakthroughs in research. We have found many ways to manage patients with diabetes. We have new solutions. We have pills that help patients to get rid of excess sugar through the urine. We have pills that can help patients to regulate the appetite um, center. We have pills that can help signal to the pancreas more, and the list goes on. In fact, this slide is not exhaustive. What I'm trying to state is that there is a lot more options now for the modern day doctor to help patients with diabetes than we had 10, 20 years ago, which is great. So more solutions for our patients to help them get good control over diabetes. Because I think not one method works for all. I think we need to find the right solution for the right patient. Okay, so let's put all those medications aside. Let's talk about natural, healthy ways to even prevent diabetes. I think this is something that is important to us. This is the My Healthy Plate. I think it's something they can see from the Health Promotion Board. Okay, and I totally agree with it. The important thing is that we cannot eat too much carbohydrates. So you can see on the healthy plate, carbohydrates only consist of 25% of this plate, which I agree is the right amount for average person. Okay, and in fact, we would advise if the carbohydrates can be low glycemic index food, things like brown rice, wholemeal, food that does not cause the blood sugar level to spike up as high compared to white rice, to typical white bread. But I don't think this is something easy for everyone to adopt. And I don't insist that everyone change to completely to brown rice and wholemeal bread, but this is an option that we can think about. Okay, but at the very least, we need to think about portion control. On the right hand side, you see a group of people exercising together. Now we know that this is impossible during this COVID restriction. So this slide is not, in a sense, relevant during COVID break. So now we need to think about home exercise. We need to think about home individual exercise, running, not as ideal as group exercise, because in a group, people encourage each other to keep up in the exercise. But nevertheless, because of the COVID circuit breaker, we need to think of clever solutions around it. Find ways to exercise at home, find ways to maybe jog, brisk walk on your own with the mask on, right? Okay, well, if you are jogging or doing something more vigorous, please do not do it with a mask, because that will reduce your oxygen and that will be increasing your work of breathing, which is something I would not agree with. Okay, so let's move on. What is wrong with this picture? I think if you had paid attention to the slide earlier, you will realize that this is recipe for disaster for patients who are prone to getting diabetes or who have diabetes. Too much rice. I mean, there are patients who told me that They don't feel full unless they eat 2 to 3 bowls of white rice per meal. That is entirely excessive, needs to be reduced. Or they drink lots of sweetened beverages. Again, this is bad calories, this is bad sugar. It has to be stopped. So we should stop the sweetened beverages. We should portion control. And as I said, if possible, we should consider the low glycemic index variety like brown rice. If it is something that we can change, we should consider it. What else? Excessive drinking, alcohol, beer is also bad for the body, bad for health, bad for the pancreas. So for those who drink too much, we should moderate. We should cut down on the alcohol. For those who do not drink, I do not recommend that you start drinking. I think just keep it simple. Don't drink if you're not drinking. If you're drinking excessively alcohol, you should try to cut down. Number 3, at this point in time, when you stare at this, a lot of people say, hey, this is healthy, right? There's lots of fruits. Fruit juice, these are good. Every day I'll drink fruit juice, I eat lots of fruits. This is a healthy way to live my life. Wrong. I would say that you have to be a bit careful. Fruits are healthy, but again, in the right portion. I remember one of my patients, who is a mother of a GP, of a doctor, she told me that she do not eat rice, she don't eat noodles, but she eats lots and lots of fruits. She can finish 1 kilogram of lychee by herself in one setting. Her blood sugar level is high. You must understand that all these fruits have natural sweetness. Okay, so you have to be careful, especially if you have diabetes or prone to having diabetes, that you do not over consume fruits. What is worse than eating too much fruits is consuming too much fruit juice. The reason is, to create one fruit juice, you need to squeeze out the sugar of 4 to 5 fruits minus the fiber. So you're actually getting raw liquid sugar straight in your system. That's even worse than eating the fruit itself. So recommendation again, as per the healthy plate, you think about having maybe 2 portions of fruits or 3 portions of fruits a day as part of a healthy diet. What is a portion of fruit? It can be one medium-sized apple. It can be a handful of berries. You can still consider some of the sweeter fruits like banana, but think about portion. Okay, I will talk about this thing called banana later in one of my patient example, but some fruits are sweeter than others. So a banana would be possibly twice the sweetness of, say, a standard medium gala apple. So you have to think a little bit about amount of sugar, amount of carbohydrates they are putting into your body. Okay, moving on. I would say that giving healthy tips, teaching how to eat right is well and good. But in Singapore, in the food haven that we have in Singapore, we have too many temptations. For our children, perhaps it's donuts, but for adults, it will be typical Asian delights, Western food, all the various kinds of cuisines that we can now get them very easily from delivery services, even while we are staying at home, working from home. So we cannot eat at a hawker center, but we are speed dialing, Food Panda, speed dialing, Grab food, and we're getting all this delectable food straight to our home. And this is something of a concern if you have diabetes. I'm going to take a step backwards and share briefly about my own experience. I do not have diabetes, but I have a keen interest in diabetes because I have a very strong family history of diabetes on both sides of the family. And from research, we know that when your family members have diabetes, especially if your parents have diabetes, you have a higher chance, a higher risk of developing diabetes. So it is even more important to adopt healthy lifestyle to prevent having diabetes. Back in 2014, when I was having a fellowship in Sydney, I I participated in this research trial where I put on a device that can measure my glucose level continuously over a 24-hour period. Now, you will notice that it started at my this sugar level started at around 5, which is quite normal at 11:45 a.m. And then suddenly it shot up to 10 before it came back down again to 5. And around here, it went up briefly from 5 to 6 before it come down. And then the sugar does move up and down in a certain dynamic pattern. Now, you probably wonder, what is happening to my body? Let me share with you. For the first encounter, I went to a burger joint and I ate a full meal, burger, fries, and a full sweetened beverage. And I finished it all. And that caused my sugar level to shoot up to 10 within an hour. But fortunately, because I do not have diabetes, my pancreas is able to produce enough insulin and the sugar went back down to 5 by 2 hours. So I do not have diabetes, but you can tell that this meal is quite a stress to my system. What about the next one? I decided to do another activity. I did vigorous jogging all the way to the Sydney Opera House for 30 minutes, and my blood sugar level moved up from 5 to 6 during this vigorous exercise. I just want to emphasize the point that not just food, carbohydrates can make the blood sugar level increase, but even stress level, physical stress, emotional stress also play a part in affecting our sugar level because those stress hormones work against insulin. So I think this is also another important take-home point to you all, that there are many factors that affect diabetes, that affect the sugar level. What about the last part, this part? I decided to cook in my apartment a healthier meal compared to lunch. I drank tea without sugar, had a smaller portion of carbohydrates, veggie, protein, and my blood sugar level only went up to about 7 and then came down properly. So I think in this 24-hour snapshot, I give you an idea of how our food choices, our lifestyle choices affect the way that we, how our sugar behave. Back to the exercise. My sugar level did go up to 6, but that's still acceptable. But this again tells us that if you have never exercised for a long time, do not suddenly go into a vigorous exercise that your body cannot handle. The stress hormone and stress effect may be too much for your body to handle. Exercise carefully with your doctor's advice. Okay, moving on. Let's talk about some of my patient snapshot. I'm going to go through this quite quickly. What do you think? Stare at this food. This is a picture that my patient took of a breakfast that he ate at a hotel. Is this considered healthy? Well, I think it looks healthy. There's fruits, there's vegetables, there's protein. However, for my patient with advanced diabetes, his sugar shot up to 16.5. He's a 71-year-old with many years of diabetes. His sugar shot up to 16.5 with this breakfast, despite taking his usual medications. Why? Because if you look in the background carefully, you see 2 bananas. Yes. As I said, bananas are one of the starchy fruits and it has to be eaten in moderation. So I think 2 bananas was way too much for my patient to take. To give you some idea, one slice of white bread has about 15 grams of sugar. One standard banana has about 22 grams of sugar. So one banana even has more sugar than a slice of white bread. And if you eat 2, you're eating almost close to 2/3 of a bowl of white rice. So not everything is as innocent as they look. Okay, so for him, he has no choice but to eat something more careful, maybe oatmeal, tofu, and his blood sugar level is more stable. So you can tell that I like to use this technology that measures the blood sugar, or sorry, the glucose level in the body continuously. So you can get a nice graph. So you can tell before he ate 6.7, after he eat the meal, it goes up to 10, and after that, it starts to come down to 9 point something. Another example, a 29-year-old young girl with 10 years of diabetes. I mean, she had diabetes even in high school. I show the first graph, 7 January. Her blood sugar level can be as high as 19.6, very high. And this is at 6 a.m. We had to use medications, we had to treat her diabetes, and we changed her lifestyle. And you see, 10 days later, her blood sugar level for a 24-hour trend, 5.4, 5.5, 6.2, 8.8, 9.0, 7.3. Much, much better, more controlled than ever before. But of course, if you look at what she eats, oatmeal breakfast, yong tau fu, lunch, dinner without rice or noodles, it may be difficult for such a person to maintain such strict diet for a long time. So after some time, when she's more stable, I allow her to have occasional cheat snack, cheat meal. Like in this case, in 12 May, she had a messy bun from Bread Talk, and and her blood sugar level did not shoot up. Why? Because her diabetes is now well controlled, that she can allow the occasional carbohydrates indulgence. So I think it's all about finding the right balance for each individual. Okay, I'm going to sort of end off with this example to give us an idea of lifestyle intervention. Makes sense. So this is a 45-year-old man. He's overweight, 78.5 kg, BMI 27.8. Both his father and mother have diabetes. He went to do a checkup. His fasting sugar level is 6.7. If you recall from my earlier slides, if it's above 7, that's diabetes. If it's below 6.1, that's normal. So what's 6.7? That's in between. Is that pre-diabetes? And we did, or rather the GP who managed him did a challenge test, make him drink this very sweet 75 grams of sugar, and measured his blood sugar level 2 hours later, and it shot up to 12.6. If you again remember my original slide, if it's above 11.1, we need to think about diabetes. So based on these two results, there is a strong suggestion that he may have diabetes. But the question is, do this patient wants the stigma of having the diagnosis of diabetes? And also, some of my patients are concerned about their insurance coverage. So there are a lot of things to think about, not just about securing the diagnosis of diabetes. So based on this data that we have here, I cannot diagnose him with diabetes just yet. There is a criteria that we may need to repeat this test a second time to confirm, especially if this patient do not have any symptoms of diabetes. But I decided to help him. I decided not to proceed with a second test to confirm diabetes. I wanted to help him with lifestyle to reverse his sugar and not get the diagnosis of diabetes. So what I did first and foremost was to put on that little patch to allow us to understand how his usual blood sugar level is day to day. So you could tell that with his usual blood sugar level is not too bad, about 4.3, 4.4, but after eating, it can go up to 11.6, it can go up to 10.4. So clearly, his food choices is an important thing that we need to tackle. So that's what we did. We focus on healthy eating, we focus on weight management, we focus on activity and exercise, and we managed to get him to lose a few kg in a month, less than a month, which is great. And now if you look at his sugar pattern, his sugar pattern is now a lot tighter, a lot closer to normal. And when I did the formal test, blood test for him, he is not diabetes. He is not pre-diabetes. So he's in a very good place. Let me show you another example. This is another patient who started off with a weight. So you look at a chart. He started off with a weight of 99 kg, right? And his blood sugar level was as high as 8.6 without food, and as high as HbA1c, 3-month average, as high as 6.7%. After we do lifestyle intervention, and his weight from 99 kg dropped to 77 kg, his fasting sugar from 8.6 dropped to 4.5. his 3-month average dropped from 6.7% to 4.9% without medications. Not just that, he also had benefits in his cholesterol levels. His cholesterol was not high to begin with, but went from normal to fantastically low. Low, I mean, not low, but very good levels of cholesterol with very, very low bad cholesterol with very, very low triglycerides. So this is another excellent example of how with lifestyle intervention, we can prevent, we can reverse diabetes. But not all cases have such a happy story. Skinny diabetics, to me, is one of the most challenging cases to manage. So this particular patient, he weighs only 50 kg. In fact, probably about 48 to 50 kg. Very light in weight compared to his height. And he has very difficult to control diabetes. You can see his sugar level as high as 18.8, 18.9. What does this tell me? Is there any point telling this patient to lose more weight? The answer is probably no. It's unlikely that it's the weight that's causing the diabetes. So for such cases, the problem is in the pancreas, that the pancreas is not working well. And unfortunately, for such cases, we may have to use more medications, even insulin injection if needed, to help them get the sugar under control. So this is him after we gave him medications to control the sugar. So in summary, after I've explained so many things, and I think some of you may have to refresh the slides to get a clearer idea of my presentation. What I'm trying to propose is that for many patients, many individuals, with the right lifestyle, perhaps we can use less medications or no medications at all to prevent or to control diabetes. But for other cases, the more serious types of diabetes, we may have no choice but to use, hopefully, the right medications, the right injections to keep it under control, and therefore reduce their risk of having diabetes problems like heart problems, kidney problems, eye problems, feet problems, and so on. So, and that concludes my talk. Sorry, I overran a little bit, a few minutes after 10:30. Um, if you all have uh, any burning questions, you could drop me an email. The email is there. My clinic email is there on enquiries@diabetesendocrinecare.com. Okay, or you could even perhaps collate some of your questions and um, pass it to the event organizer, and I will see if there's a way for me to answer those questions.